This next adjustment is a supine bimanual thumb thenar grasp, proximal humerus with distraction for mobilization of the GH joint. I add this adjustment in. I've never seen it in a formal testing environment like in an OSCE or like a board exam. But I add this adjustment in because I promise you, you will have patients that will come into your clinic and they want you to work on this shoulder. They'll say, "Doc, this shoulder hurts," and then they're here and they're not going to let you move it, right? And so we've got to do something to get some motion into this shoulder, because I can't even do an assessment without moving that arm around a little bit. So I need to get some sort of a motion into the shoulder, and that's what this adjustment, which is more of a mobilization, does for us. So what I'm going to do is I'm going to position my patient as if she is antalgic. She's protecting that shoulder. She doesn't want to move it, okay? What you'll need to do is you'll need to find a way to grab that contact on that superior humerus here. And so what I'll do is I will, in talking with my patient, I'm going to be talking to them the whole time. And I see I've got my hand on their shoulder here, and all I'm doing is just a slight external rotation. I want to know, is that okay? Is it okay if I move that arm this way? And then I'm going to work my way in between her arm and the side of her chest here. So I want to make sure that I'm clear with my patient. Hey, I need to get into this area here, and I'm going to be as absolutely tender and as gentle as I can to get into that contact, but I need that contact. So there might be some times where this is uncomfortable, and that's okay. We're going to work through that discomfort, and we're going to add some motion here. So I've got this contact here. I just need to match it on the outside. So if we look at it as a supine bimanual thumb thenar, I want that grasp here. That's a really sturdy grasp. And all I want to do here, this is a mobilization, is I'm going to start adding some circumduction. Okay? And my goal is to just induce some motion in that shoulder. I may, if you remember, we did a compression and decompression component. If I can get some motion here, I can add that compression. If I compress it and she says, "Oh, okay," well, I'm going to decompress it. Maybe that feels a little bit better, and I'm able to add some motion there. Once I've got that little bit of motion, I'm going to try building on it. I may even work my contact down and do like a reverse pendulum swing where I'm using her arm here and I'm just doing a mobilization here to try to get motion into that GH joint, so I can do an assessment here and see what exactly is the cause, what's the problem. It's likely more than just a restriction if a patient is that antalgic. So again, we're going to start with that bimanual thumb thenar contact, but getting in and mobilizing that shoulder is super important so that we can get a little bit of a palpation in, but then also like a functional assessment of that shoulder so that we can assess what motions are lacking in that shoulder and what exactly has happened that they're this antalgic. So again, this was a supine bimanual thumb thenar grasp, proximal humerus with distraction for mobilization of the GH joint.